Reports say obesity, diabetes, and cardiovascular diseases, non-communicable diseases, now account for nearly 30% of deaths in Nigeria. This informed the National Conference on Sugar-Sweetened Beverages (SSB) tax in Abuja, where experts gathered to discuss the urgent need to boost Nigeria's public health response. The conference tagged health tax as a recipe for improved healthcare financing, highlighted the potential of SSB tax reform to curb these health issues. The coordinating Minister of Health and Social Welfare, Professor Ali Pate, in his speech, underscored that Nigeria's current tax of 10 naira per litre is insufficient. According to him, recent reviews and meta-analysis by the International Diabetes Foundation show that as of 2021, over 3.6 million people are diabetic, with 53% of these citizens undiagnosed, and this number is expected to rise to about 5 million by the year 2030. The minister also raised alarm that associated healthcare costs are escalating, especially as the cost of treating diabetes per person has surged from an average of 60,000 naira in 2011 to 800,000 naira in 2021 and projected to exceed 1 million naira by 2030.
As we look to the future, we must view the SSB tax as a cornerstone of our strategy to improve public health and healthcare financing. By discouraging the consumption of sugar-laden beverages, we aim to reduce the prevalence of obesity and diabetes.
Advocates, including the Executive Director Corporate Accountability and Public Participation Africa, CAPA, Akimbode Oluwafemi, are pushing to raise the tax to 130 naira per litre to align with WHO recommendations, as well as to ensure funds are allocated to public health initiatives.
Nigeria needs a public health policy that recognizes sin tax as one of the key tools to reduce NCDs in Nigeria, as well as begin to get the necessary resources to finance healthcare in Nigeria.
Healthy diets are crucial for promoting health, supporting active lifestyles, and preventing diseases, including both communicable and non-communicable ones.
Food justice, the right to eat what nature wants me to eat. The right to access healthy and nutritious food. And in this case, we're looking at access, affordability, quality, and culturally available and acceptable food.
Healthy lifestyle, because it is actually considered the primary intervention in the health sector, because you start with prevention before you talk about treatment. And it is with prevention that is very important that we'll achieve, especially when we look at the report that says that the age bracket that mostly consumes sugar-sweetened beverages is between 17 and 19.
Non-communicable diseases have been increasing in the continent, and what we have identified is that sugar is the main risk factor for non-communicable diseases because it can lead to increased BMI, which can result in overweight and obesity.